Well, it's another conference, and so of course, another exhibit hall. Anyone who knows me knows that I love being in exhibit halls, checking out all the great technology, all the great companies, and talking to people about the trends that they're seeing and the conversations that they're having in here. I'm here at the OntarioMD Digital Health Conference 2025 in Toronto, Ontario, and I had the chance to tour this lovely exhibit hall to talk to some people about one thing in particular, AI. Now, while I was here, I had the chance to talk to a number of companies that are doing some interesting things with AI, particularly around AI scribes, but I also wanted to get from them what conversations are they having with people who are coming up to their booths. Here are a couple of those conversations.
My name is Mahshid Yasai. I'm the co-founder and CEO of Tali.ai. We are the leading AI scribe in Canada. Over the past 3 years that we have been expanding our service across the country, I have never seen so much interest in AI in healthcare. Everybody is talking about is how it's changed their practice. What they're asking, what's next, what's coming, and we're so excited to be here. I think probably one of the best times to be at the intersection of AI and healthcare. Tali started as an AI scribe as a core functionality. We listen to the conversation between a clinician and a patient, and we generate the documentation that will then, with the clinician's approval, update the patient's chart. There are some inherent complexities about building a great AI scribe, I would say, and that every clinician has their own style of documentation. Sometimes they use different languages during the visits. The level of details, making sure there is no hallucination, the accuracy of the notes, all of these are very small touches, but because the bar in healthcare is so high, it might be easy to build a not so good AI scribe. Building a great AI scribe, we don't think is that easy. But also there are so many other areas in the workflow that physicians are asking for. They're asking for filling out, that was to fill out their forms, whether it's WSIP or insurance forms. Take it to the medical search, basically consulting the evidence-based resources at the point of care. And this list goes on, and that's where we have been focusing our time. Our vision is to make sure we're taking care of more and more of the documentation and administrative tasks for clinicians so they can focus with their patients and have face time with them.
Hi, I'm Noah Crampton. I'm the CEO of Mutual Health, and we're commercializing the AutoScribe AI scribe tool. It's one of Canada's leading AI scribe platforms, trusted by over 5,000 users across the country. And we're at the OntarioMD conference trying to inform everyone about all the new tools that are coming down the pipeline on top of the AI scribe. So, for instance, we're going to be able to automate EMR actions, enact prescription requests and test orders. We're going to be able to fill in PDFs based on voice data from dictation or from patient encounters. So really exciting stuff coming down the pipeline, and we're having great conversations about that here.
Hi, Scott Schroeder with McKenzie Health. Today we're spending time talking with providers and executives and decision makers about AI solutions in the medical clinic, hospitals, and at OMD. We're currently focused on AI solutions, so Mika AI Scribe by McKenzie Health. It reduces charting time by 60 to 70%, saving physicians 1 to 3 hours a day, giving that time back. So our conversations today are really focused around getting physicians' time back and allowing physicians and providers to better focus on patient care and really being present during that visit.
Hey there, I'm Jesse from CIHI Health. I look after our North American team here.
And I'm Maureen. I'm also from CIHI Health, and I look after Canada for marketing.
We've loved the conference so far. We're having some really interesting conversations. I think for me, the thing that stands out is we've seen the first wave of AI implementation, all the kind of point solutions that have come out, from Scribes to intake to all the things that come after that. I think the things that are really sticking out to me this time around is all the conversations about how you build that into kind of a 360 view of how does intake talk to in-consult, talk to post-consult, and how do you tie that all together in a meaningful way? And I think it's something we're trying to commit to quite deeply at CIHI Health from some of the things that we're demoing, some of the secret things that might come next. But for me, that's been super interesting to talk to. How about you?
Yeah, I'd agree. The ability to create a more comprehensive solution in terms of AI is something that's super exciting to us and our forward-looking roadmap. So being able to connect with all the different specialties and the hospitals and everyone involved in making that a thing is super exciting.
Yeah, and I think also the uniqueness of the Canadian market in comparison to the UK or the Australian market, New Zealand, the US, all places that we operate, but Canada has like a very unique perspective on this as well. I think we've seen a lot of sophistication coming from government, coming top down as to how to look at these types of tools and where do we go as a region from here. And so it's been really interesting to talk to people about the Canadian specific use cases for some of these tools. And we're really proud to support Canada, and we just set up our Vancouver office on top of our Toronto office. So yeah, we're committed locally, and really looking forward to bringing more tools to the market.
Now, while I was here, I also had the chance to catch up with CIHI, who are doing some very cool things around driving interoperability across Canada. They're really focused on getting people to the table to make sure that what they're putting together is not just a standards-based approach, but an approach that actually will bring value to the ecosystem.
Hi, I'm McKenzie from the Canadian Institute for Health Information, and I'm really excited to be here today at the OntarioMD conference to meet with the participants and talk about the work that CIHI is doing to help advance the connected care in Canada. And this includes co-designing the common data standards and data architecture with people with different experiences and expertise, from clinicians to patient partners to our digital health organizations and vendors and provinces and territories, to really define the source of truth for health information that can be used for both primary use and secondary use of that information. So therefore, having good quality information that will follow the patient across the continuum of care, and that same information being used over and over again to help with clinical decision making, operational planning, and health system use and health system planning.
Now, the last time I was in an exhibit hall here in Canada, I had the chance to catch up with my friend Mark Castleman from Equinox. Now, since that time, when I last spoke to him, till now, they've done a lot of work to get their product off the ground. So I was excited to catch up with them to see where they are now.
Hey Colin, great to see you. It's Mark Castleman, Chief Growth Officer with Equinox. And since the last time I saw you at eHealth Conference in Toronto, and it's great to be here today at OntarioMD, back in Toronto, we've really been moving forward with our partners, clinicians on CarePath. And so now, today, we're inviting early adopters to begin using CarePath. We have an innovation sandbox that's available to put clinicians in with synthetic data and begin using this with their own workflow. And as a next step, we begin to connect it with actual live patient data once they've established that workflow connection and seen that it's providing value for them. We're really excited about CarePath because it is EMR agnostic, so we can work with all partners across the ecosystem. And at Equinox, we're really focused on reducing fragmentation. And a key part of that is to connect data systems using our platform links across the system that is enabling partners to really get to value quickly.
Now, while I was here, I also had the chance to sit down with Robert Fox and Dr. Chandrasena from OntarioMD to ask them about their take on OntarioMD's work and the industry in general.
Well, I think from a high level, I'm seeing this thing that's been termed convergence. Okay. So we're seeing a lot of people coming together, systems coming together, people coming together, care providers coming together. And I think that that's the secret sauce to really accelerating our healthcare system. Okay. We're seeing change at a system level where OHTs, primary care network, local delivery groups, the work that Dr. Philpott is doing, the work that Ontario Health is doing, the work the ministry is doing, the work the OMA is doing, is all coming together. It's not like they're independent, they are completely integrated. We're seeing convergence as well at a technology level, where different providers are now integrating their solutions with interoperability standards and capabilities. So there's this sharing of information so that there's more seamless solutions for physicians. And then the last one is around vendors. So vendors are now creating solutions that can integrate with any of the EMRs, can integrate it with any of the hospital information systems like Epic, Oracle Health, and Meditech.
Right.
So we're seeing the system coming together with these collaboratives, with this converged mentality that we need to be more cohesive. And so I'm really excited about that. Doctors are collaborating more with each other, leveraging digital tools. There's a focus on more team-based care, and so engaging more care providers in the team and supporting patients in outstanding care.
Yeah, so I think it kind of comes down to digital health. So I think everyone thinks, okay, you've got your clinic, you've got your clinical processes, and then digital health, right? And I think we have to start integrating them together. And then everyone's like, well, I just want a recipe, right? Like, tell me what steps to follow so that my clinic can be digitally optimized. And so I can't give you a recipe because technology is an enabler to the problems you have. So what I think we have to do is we need to have standardized workflows for sure, and some sort of roadmap, and kind of, I don't like to call it a recipe, but I call it a structured toolkit.
Okay.
And I think it needs to be able to be flexible to who you are. So if you're a brand new clinic about to open up, then yeah, you could have the more mature structured toolkit. But if you're an existing clinic or bringing two clinics together, it's going to be very difficult to follow. So I kind of feel like that one has to be kind of tailored to you. But we don't want everyone to do their own stuff because that's what we're doing now and it's not working. So you need it to actually also be a bit standardized. So everyone's kind of like choosing an adventure, but the adventures are limited by the book. So you can kind of allow for that innovation, but at the same time, you know you've got key things in place that allows us to work together.
So what's my final takeaway from this exhibit hall here at 2025's OntarioMD Digital Health Conference? Well, number one, AI everywhere. It is the talk of the town, 100%. But a little bit of a nuance this year versus last year. Last year, total excitement over AI Scribes. This year, it's a lot more about, okay, how do I optimize the use of AI Scribes? What guardrails do I have to put on? What is the governance that I have to have? So I think it sort of represents a maturing of how we are adopting AI here. I definitely got that message being here in the exhibit hall. The other thing I'm taking away from this exhibit hall is, of course, that the focus here on primary care is exciting. We need more primary care, and I believe exactly what all of these vendors and what OntarioMD is talking here about. And that is that primary care is the access point to so many citizens to the healthcare system in general. So we need to have the primary care system robust. That means we have to take care of the clinicians, the family physicians. We also have to take care of their digital needs, and we have to bring patients and these docs closer together and bring the docs closer together with the rest of that healthcare ecosystem. And I'm happy to say, just based on the number of vendors and the interesting technologies that are here, that is definitely happening. And hey, if you enjoyed this quick summary, please mash that like button and click subscribe so you can be notified of more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.